And welcome back, our dear viewers. And after this delicious report that we had about cashews, of course, now we are into another field, which is the modern plastic surgery. And everyone knows it's no longer about dramatic change, but about precision, minimal intervention, and natural-looking results. One of the advanced techniques that gaining attention today is the endoscopic brow lift. A minimally invasive procedure that uses endoscopic technology to lift the brow area, reduces signs of aging, and achieve a refreshed appearance with the smaller incisions and faster recovery. So with us, our viewers, Dr. Sherif Bakri, plastic surgery specialist, to shed the light on this technique and explain why it has become a preferred option for many patients. So, Dr. Sherif, good morning and thank you for being with us.
Good morning, and thank you for the very nice introduction. It's
You're
just
welcome.
to the point. Now in 2026, plastic surgery is shifting to the normal shape, keeping the best of yourself, not having strange looks or to be all women the same shape at the same time.
Exactly.
So that's 2026 now. Just keep your normal shape in the best way. That's the idea.
Well, we hope.
Yes.
I hope for that. People are, I believe, even for men, starting to look very similar. So, about this endoscopic surgery, and to begin with exactly, the endoscopic brow lift, how does it work exactly, and how does it differ from traditional brow lift techniques?
The idea of the endoscope that you have a 4mm camera, very tiny camera. You go in a strategic incisions. So with this tiny camera, you can cover the whole area of the upper face. So you can have a better harmony, affecting the whole area. You can do very precise and safe surgery with very minimal downtime, just with this very tiny incisions.
So, when did the use of endoscopic technology start in brow lift procedures, and why is it considered a significant advancement in plastic surgery?
The idea of endoscopes started in the 1990s. Yet from that time, there are lots of advances in the type of the camera and instrumentations, and also in the experience that was built through the years.
Mm-hmm. Yes.
So through these tiny incisions, we strategically plane these incisions to be completely hidden behind the hairline. And you can go deep, just on the bone, and you can elevate all the area of the upper face to restore the harmony. The first area in the face that it faces the aging, the change starts in the upper face. Our skull, the area of the eyes, around the eyes, the bones itself,
Okay.
it starts to change. So the aging starts from upwards. That's why we use these technologies to restore the brightness of the face earlier.
So, you go through this area, which is the upper area, before it goes inside and change the bone shape, and you try like to adjust it? I'm sorry, I'm not 100% with the full information about the endoscopic surgeries.
The idea,
yes.
aging process is a continuous process, starts from the 20s. By the end of the 30s, you find that the brows are heavier on the lady, and the opening of the eye looks more tired. So lots of ladies, they seek some help to have this bright eye look and to remove all the heaviness on the eyebrows.
Yeah,
That's why we start like late 30s, and we can do this till the early 50s. That's the area that the best treatment will be the endoscopic brow lift.
To be looking more fresh.
More fresh, more natural, and more rested.
Okay.
Yeah.
More rested. That's actually beautiful. So, from medical perspective, as we're talking about that, what makes this technique less invasive compared to the conventional brow lift surgeries?
The whole idea that you can do lots of steps through very minimal incisions. Through minimal incisions in the skull, just behind the hairline, you can reach the whole upper face. You can reach the cheeks. You can correct the upper and lower eyelids. You can elevate the brows. You can correct the forehead. You can do all these things just from tiny incisions, just 2 to 3 millimeters, and this will be completely hidden. That's the whole idea.
And the substance that you put inside the face, there is a substance. What is it called?
We don't use really substances. We fix everything to the bone. We go under the deep tissues.
Yes.
So, and we have natural anatomical repositioning of tissues. We don't put things inside.
You don't put things inside?
No.
You reposition everything inside.
The
you put
idea,
it back.
we go to the deep plane.
Okay.
We separate all the tissues and reposition them in the natural anatomical area without adding lots of things inside. Nothing inside.
That's how it doesn't change the look of the person that's doing this surgery.
Exactly.
And that's also how it makes it look natural.
Yes, that's the idea. We need to have a natural, precise look.
Okay.
All the time.
That's actually beautiful.
Yeah.
Whatever you guys are doing is actually, you doctor also, you're actually doing a remarkable job regarding that, so thank you. So on the next question that we have, who are the ideal candidates for the endoscopic brow lift?
The ideal candidates, the ladies that started to have heavy eyebrows, they have this tired look for their eyes. Lots of ladies after losing weight, they start to have sagging in the mid-face. All these things that can be corrected easily without lots of downtime just by the endoscope, these hidden scars. Also using these small scars compared to the conventional surgery with having wide scars, this gives us very nice recovery time, very short going back to their works, and this helps a lot to have this natural result.
Okay, I believe even for men, if they wanted to do this surgery, if they had a lot of wrinkles or something,
yes,
maybe they can do that.
But still, like 90% of the patients, they are ladies.
They are yes.
Ladies.
Well, since it's just repositioning, it's like when first men started, it wasn't okay for men to do the nose job. After that, if you had like some problem or something, it's becoming more natural to do it. So maybe in the future, even these procedures you will become see more men in the customer line.
Generally, in the statistics of plastic surgery worldwide, men are increasingly demanding plastic surgery, but still women like 80% now. But
still at the top.
Yes, but still men, it's a high demand for plastic surgery.
Course, we hope on the logic field, and of course on you know, to have it more in the same area, not to do overly surgical fields for men also. So does this procedure only affect the position of the eyebrows, or does it also improve the appearance of the forehead and the eye area?
The idea is to restore the upper face harmony. We need to restore all the harmony of the upper face, the cheeks, upper and lower eyelids, eyebrows, forehead, temple, all this area through these tiny incisions. It's all about harmony. We see the patient, we evaluate all these areas, then we decide the best steps that we need to take. And we can do all these steps just through the endoscope. Beautiful.
So in the terms of incisions and scarring, how does this endoscopic approach compare to traditional methods?
The old traditional methods, it was depending on having lots of tension. Just remove some part of the scalp and have lots of tension. That's why we had lots of problems in the scars and loss of hair. But with these techniques, we go very deep. It's like a deep plane, upper facelift. So the tension on the wounds is very minimal. The way that we cut the wounds, we intentionally aim that the hair will grow through the wound itself. So through the next 2 months, the wound will be seldomly seen with no hair loss, no problems at all. That's the whole idea. Also, going with these tiny incisions, we preserve all the vessels, all the nerves, all the important structures, and we can see this precisely. So we protect all the nerves and vessels and everything. It's very different. Yes.
So there is nothing to be afraid of when if there is a woman wanted to do the surgery.
The complication rate is very minimal through the whole world, and you see exactly what you do. From incision here, you can see all this area, all the structures inside, and you do all the cuts under direct supervision, so the complication rate is very minimal, really.
Beautiful, beautiful in every aspect, from every corner.
Yes.
So, what should the patients expect during the recovery period, and how soon can they return to their normal daily activities after the surgery?
For all facial surgery, we have some sort of swelling, may be bruising. But through these tiny incisions, the swelling and bruising will be very minimal. The patient can return to normal life like in a week. It will be just few 2-3 days with really swelling at the start, but soon the patient can return to normal life. And when they come back to work, nobody will notice exactly what was done. It will be just refreshed, rested, as I told you, and there are no scars in the face. It's nothing.
It will be like that they are putting any social media application filters.
Like filter,
or
yes.
Like,
exactly.
Exactly.
Yeah.
Or like maybe they just came back from the salon.
And this is the thing that lots of Hollywood stars, they make, and what's the change? They look refreshed, they look younger, but there are no scars on the face, no facelift scars. That's what they do.
Looking more beautiful, but nothing noticeable that changed.
Yes, just lifted,
Yes.
natural. That's the idea of the surgery.
That's actually
Good.
great.
Yes.
And also great, I think, to be talking about on this lovely morning. Unfortunately, Dr. Sherif, we reached out of time for today's episode and today's interview. So I believe that we had an amazing time.
I'm very happy to have this opportunity to show that we have minimal surgeries, very advanced, and we can achieve lots of things to keep the natural look all the time without having these strange looks.
Yes. And an overwhelming procedure that makes the person look very different from how they were. The aim is to look natural, is to look beautiful, and everyone is beautiful
the best of yourself, not like anybody else.
Exactly. So thank you so much, Doctor, for being with us.
Thank you for this opportunity. Thank you.
And with that, our viewers, now we'll go on a break after this lovely interview with Dr. Sherif Bakri, plastic surgery specialist. Then we'll be back. Stay tuned.